Washington Examiner healthcare reporter Paige Cunningham here to break all this down. Paige, nice to see you. 116%. That almost sounds like the price of oil going up.
Right. Well, this has certainly been a real sticker shock. Now, we knew that the Obamacare rates were going to be higher, but the administration just confirmed that in the last week, and it really kind of served to bring Obamacare back into focus in this election. The healthcare law weirdly has kind of taken a back seat for most of the election, but now you hear Donald Trump really trying to hammer these rate increases on the campaign trail, and a lot more attention by senators in some of these tight races, especially in states where you see some of these really big hikes. A good example is Senator Richard Burr, who's battling for his seat there, and you see big rate hikes of about 40%, and then really diminished competition as well. That 90% of the counties in North Carolina will have only one insurer selling in the marketplace there. So really turned into a potent political weapon for Republicans.
All politics are local, and sometimes folks say, hey, look, it doesn't affect me. What do I care? What percentage of Americans, of voters, generically, I know it differs state to state, are affected by the rate increases we're talking about here?
Right. Well, that's a really good question, because I think this is a big misperception. It's actually a pretty small number of Americans, about 11 million or so, that have been getting their coverage through the marketplaces. Most Americans, as President Obama has pointed out, still get their coverage through their employer or through Medicare. That isn't to say, though, that this isn't a good political weapon. Republicans for years have been predicting that the healthcare law wasn't going to reduce costs or provide these plans that Democrats have promised for a long time. And so for the very first time, they actually have real evidence that there are some tangible problems in the marketplaces. So, you know, it's an outstanding question as to how much the law is going to really swing any races. It may help Republicans out here and there, especially in those tight races. But because you are seeing a relatively small number of Americans actually affected by the rate hikes, that may actually take away from some of the political potency.
The one thing that markets hate, and the insurance market is a market like any other, is uncertainty. How much of these rate increases and these rate hikes going into 2017 are the uncertainty from the insurers going, we don't know what's going to happen. We don't know if Donald Trump's going to be president. He's going to try to repeal Obamacare. We don't know if Hillary Clinton is going to be president. She's going to try to do something else with health care. How much of this is the insurers protecting themselves, and how much of it is simply health care costing more?
Well, that's one of the key questions for insurers, which is that who is going to enroll in these marketplace plans? And nobody really knew when the health care law was passed. The hope, of course, was that more young, healthy people would sign up. They have not come in the droves that the administration had hoped for. And so I think you saw a lot of insurers that were really optimistic at the beginning. They underpriced their products for the first few years, and then they saw that the enrollees were actually sicker and higher cost. And so they're having to sort of compensate for that by some of these really big rate hikes. And so I think you see advocates for the law saying, okay, this is just the market correcting itself, and we may not see rate hikes this big in subsequent years. But regardless of how you dice it, you do have this portion of folks in the marketplaces who are seeing big rate hikes, who are going to have to change plans. And then, of course, remember, subsidies are available to most people, but there is a segment of consumers who can't get any subsidies at all and are having to pay the full cost of the plans. And so, you know, the goal, again, this next year, of course, by the administration is to try to get more of these young, healthy people to sign up. And I think the health of the marketplaces going forward is really going to hinge on whether they can accomplish that goal.
And we know the number of healthy people that at least the Obama administration had hoped and projected when we saw those rosy and wonderful numbers have not exactly shown up. One quote I saw that young people like beer money more than they do health insurance. So go figure for that in folks in their 20s. Paige, appreciate your time and your expertise as well. This will obviously be a big issue in 2017. Have you back to talk about it.
Thank you.
All the best. Liz?
Well, just after the break,